Good evening. My name is Jim Kennel. I am the fire chief with Miami Township Fire and Rescue Department. I'm here tonight to discuss issue number 16 coming up November 6th, election. And issue number 16 is the Miami Township Fire and Rescue Renewal Levy. And a renewal levy means no new taxes. It's just the levy that we are asking our community to support us and renew this levy to keep our fire department functioning as it is today. That levy was last approved in 2020, and our new renewal period is 2025 through 2029. So the last levy was 2020 through 2025. And it is a reduced rate from 3.8 mils to 2.3 mils. And the levy impact generates $595,182 each year for the fire department. And it costs a property owner $82 per $100,000 of appraised value. That is almost 50% of our yearly operating budget. We have another levy that is a permanent levy that also funds the fire department, which is the other 50% of our levy. But this levy, it's a renewal, so it needs to be brought to the public every 5 years. What do we use this money for? Well, we use this money to pay firefighters. We have 7 full-time, paid, with benefits, firefighters, to work a day on 24-hour shifts, and we supplement that staffing with part-time firefighters, which we have approximately 9 active firefighters that fill in a third position every day. So every day, 7 days a week, 24/7, we have 3 people on duty. I work during business days, Monday through Friday, various hours, 40 hours a week, and then there's 3 firefighters on duty, 2 full-time firefighters and 1 part-time firefighter. We are a full-service fire and emergency medical service department. We have paramedics, EMTs, and firefighters. Most of our personnel are cross-trained firefighters and EMTs. So we have 1 crew of 3 on duty. If a fire call comes in, they jump on the fire truck and respond. If a medical call comes in, they jump on the EMS ambulance and respond to the incident. We average about 3 incidents a day. Today we're fortunate because we haven't had one yet. But on Friday we had 9. So it evens out in the long run, where we average approximately 3 runs a day. We have about 370 fire and rescue type incidents, about 730 annual medical incidents, and of those 730, we take about 525 people to hospitals. So far, our run volume has been steady over the last couple years, but the area is starting to grow. We're starting to get new houses. The population's rising, and with population rising, we're also going to have more activity within the fire department. So right now, we're maintaining a pretty solid service. Our people are second to none. They are very impressive folks that really are passionate about their job and really passionate about the community, and they really love being there to provide the fire and EMS that this area deserves. This is 50% of our budget, and it is really needed to sustain our current operations. So with that said, I want to listen to folks in the audience and open it up for any questions.
Here's one question, Chief. What will be the outcome if the levy should not pass?
Well, obviously, and I tell people just like your budget at home, if you lose 50% of your budget, there has to be, the fire department won't look the way it looks today, okay? 80% of our budget are personnel costs. So that is where if we're going to cut 50% of the budget, we're going to have to cut the number of personnel that are on duty per day. Is the fire department going to go away? No, it's not. But the fire department is not going to look and be staffed and be equipped as well as it is today.
Okay, here's another one for you kind of in regards to that, is if that does happen, and I know sometimes it happens currently, that if there are fire gentlemen or folks are on a run, what happens then if there's another fire or there's another car accident?
Yeah, it's called what we refer to in the fire business is mutual aid. And we rely on mutual aid now, but we would have to rely on mutual aid even more if our budget was cut 50%. And what we mean by that is the next fire truck closest to us or the next ambulance closest to us would have to respond in when we're unavailable. But what goes along with that is it's not a one-way street. That means when they're not available, we have to respond in to them and help them. So that makes us unavailable twice as much, because we do run with Cedarville, we run with Xenia Township, we run into Bath Township, which we, at one point, we had part of Bath Township. We don't anymore, but we still run mutual aid into Bath Township to help out Fairborn on an occasional basis.
Is any part of the fire department budget, can that be utilized for anything else within the township?
No, it cannot. It is by law. If we ask for levy money specifically for the fire department, and both of our levies are set up that way, it is to be dedicated 100% to the fire department. So the township has other entities in which, but they cannot use the fire funds for those other things. Unlike maybe a city has a general fund, and sometimes city departments are not funded by they could be funded by a levy, but when they're funded by income tax and similar type tax money, that all goes back into the general fund if they don't use it, and they can use it for other things. So, but for a township levy, that your question is, no, that can't be.
So you were talking about like upkeep of some of your vehicles. Can you go into a little bit more about what you see necessary in the next few years that this levy is going to affect, as far as what equipment that you think is coming up that needs to be replaced, or trucks or something like that?
Yeah, we did a pretty in-depth evaluation of our equipment, and I'd start off with the facilities, and we appreciate the support that the community gave towards our facility. Our facility prior to the one we're in, and when I say facility, I say firehouse. That big, beautiful firehouse as you go outside of town. They were in dire straits. They needed a firehouse. The community supported it, and now we're pretty set for quite a while on a facility. Our our apparatus, and when we say apparatus, those are the fire trucks and the ambulances. They are starting to age. There are a few of the apparatus that are getting to the age limit where it costs the township a lot of money to maintain because they do have a lifespan, so to speak. In a lifespan of a fire truck is 20 to 25 years, depending on what age it is and how much it's used. I will say our fire trucks are in good shape, but one of them's out of its lifespan, but it's in good shape. That's our backup truck. But our primary truck, we are within five years from having to replace that. And to replace that truck today, it is $1 million. And that, talk to anyone now that has spec'd one and that has one coming, everybody's paying $1 million for these trucks. And if I ordered a truck today, it wouldn't be here for approximately 3 years. So you really have to plan ahead because that's one of the challenges, and you have to start planning on these large dollar items, that you have to have. Everybody has to have a fire truck. Trucks are getting smaller and trying to get more affordable, but, for a community this size, you have buildings that are older, you have brand new houses being built, you have apartment buildings going up, you have a college here, we run mutual aid to another college. You really need a typical size fire truck, which is $1 million. Ambulance, they have saved up over the last few years, and we have a brand new ambulance that will be arriving early summer next year. And an ambulance is that ambulance is costing about $326,000. So an ambulance doesn't have the lifespan of a fire truck. An ambulance has a lifespan of about 10 to 12 years. And then it really starts to nickel and dime you and cost you a lot of money to maintain it. We have a backup ambulance that we are operating out of tonight because our primary ambulance is in the shop with some motor work that needs to be done. And we're just getting that ambulance by. It's safe. We just got it repaired. Our backup ambulance wasn't back in the garage for 12 hours, and now it's first line. But it has age, and it has outlasted its lifespan, and we will be getting rid of that truck come summer when the new truck arrives. So we're just keeping up with replacing our apparatus. We are going to decommission some apparatus, which is the plan, and combine the equipment we carry in 2 apparatus into 1, because we're not that volunteer fire department anymore where we get a turnout of 10, 12 people for each call. We still only have 1 crew to take 1 truck, and so we have multiple trucks that we are looking at replacing and combining and decommissioning. So we're being as efficient as we possibly can. I think we're being good stewards of our money in our budget. But as you know, things are expensive. And I had never thought that I'd still be in the business when a fire truck was $1 million. But here I am. It didn't take long to get there. The last truck that I helped spec out was $350,000. And it wasn't that long ago. And so inflation has really hit the fire truck business really, really hard and really, really fast. So we're doing a good job, but things are really, really expensive, and that's why we need the support of the community.
Was there any type of safety equipment or anything like that directly to needs that's currently needed?
After we did a good analysis of our apparatus, then it was time to look at the safety equipment that we use. And the number one thing that we really have to start to purchase and start to looking at purchasing, 2 things, is the fire gear that we wear in fires. And you'll see it, a firefighter gets off on a fire and he's got the beige gear on, it's underneath the air pack, and the air packs on our backs. We were just told this week that they no longer make parts for our air packs. And those are the air tanks that the firefighters wear on their back that they wear in the fires. So we're kind of backed in a corner when it comes to the air packs because we have to have those. You can't have a fire department without them. So we are going to next year start looking into purchasing air packs and definitely start purchasing the turnout gear for firefighters because there is a standard that we must follow in this business, and we are out of standard with probably 75% of our gear and 100% of our air packs. They're in very good shape because they're not used a lot, but the air packs are to a point where if they break, we can't fix them.
Looks like that's all the questions.
Okay. I was asked about what's in the future for the fire department coming up. And, living within our budget, of course, we are looking at some other communities that offer a service called community paramedicine. And that is a service when our paramedics go out and basically make house calls without being called to the house. Okay, and I'll give you an example. If we have a particular person, let's say we have an elderly person that we make calls to on a regular basis, and we take this person to the hospital multiple times, that person would fall into the category of being a client of our community paramedicine. And a lot of times we find that these folks, they don't do very good sometimes follow-up care for themselves for one reason or another, whether they're not aware or they just don't think it's important. So communities have entered into this community paramedic program where they send the paramedics out to the house just to basically check on these individuals. They'll go in the house, they'll talk to them, they'll make sure they're taking care of themselves properly, they'll make sure that they are taking their medication as they are supposed to, they'll make sure that they have their medication. Sometimes we are told that, I can't get to the store to get my medicine. I don't have anybody to help me. So they need a lot of community assistance, and the community paramedics are there to help them. It's more or less a medical prevention program for folks in need. So a lot of our patients get to the point where they've let themselves go downhill so fast medically that it is an emergency. So we're out there in the community, we're visiting patients in a non-emergent fashion, and we're talking to them and we're preventing them from getting worse or getting to the point where they have to call 911 and be transported to the hospital. We're talking right now with a program in Springfield through the hospital system that runs a community paramedicine program. And so we're talking to different departments where it's been a success, and it's something that, we're exploring at this time. And we have the personnel to do it. We have personnel in paramedic school. We're getting ready to come out of paramedic school. So our numbers are where we need to be to start looking into a program like that. So something in the future that would be cost neutral to us. Any other questions? Well, thank you very much. I appreciate everybody attending. If you ever have any questions whatsoever, we are at the fire station 24/7. I'm not saying you should show up at 3 in the morning, but you're welcome to show up anytime during business hours or in the evening when you're free. If you have questions, we like to take kids and show them the fire trucks, and make it a happy experience, because a lot of times when you see the firefighters, it's not a very happy experience. So if you see the firefighters around, say hi. During Halloween, we're going to be out handing out candy bars. Christmas, we'll have Santa Claus with us. So those are happy occasions, and just go up and say hi to the firefighters. We appreciate when you say thank you, because we're not always, because everybody's in an emergency situation. We never get that appreciation sometimes that these fine folks really deserve. So thank you very much, and be safe. If you have any questions, please reach out.